Hi everyone, I'm Chrissy Midwife and today's topic is all about cesarean births. But before we get started, I'd absolutely love it if you would subscribe to my YouTube channel, hit that little bell beside the subscribe button and give this video a like and a share. You might be electing to have a cesarean section, or you may not necessarily be electing to have a cesarean section. But in 2017, 30% of all first-time mums did in fact have a cesarean birth. That is about 1/3 of all pregnant women. Because I truly believe that knowledge is power, I encourage you to watch this video so that you can find out all the information about cesarean birth. So if you're electing to have a cesarean or this unexpectedly occurs for you, you have all the information. I'm going to talk to you about the procedure, what to expect on the day. Let's start off by saying that a cesarean birth is still a birth. We need to be really supportive of each other as women and get rid of the taboo, the negativity around cesarean birth. Because let's be honest, being a mummy is a really hard job. And at the end of the day, regardless of our mode of birth, we have to remember that we have grown and birthed a beautiful baby. As I said before, the national average for cesarean births is around about 30%. But a lot of mums ask me, okay, well, what are the chances of me having a cesarean birth? And truthfully, there's numerous factors that play into that. The first is yours and your baby's general health, the hospital that you're birthing at, their rate of cesarean births, and the care provider you have chosen and their rate of cesarean births. When you're choosing both your facility and your care provider, I strongly encourage you to discuss with them on your first appointment, okay, could you please tell me what are the rate of cesarean births for this facility and also for yourself? Because that will factor in to the chances of you having a cesarean birth. But please remember, ultimately, at the end of the day, it is your final decision on how you birth. Let's start by discussing the reasons you might be having a cesarean birth. You might either A, elect for a cesarean birth, you might be B, requiring a medically indicated cesarean birth, or C, you might potentially be labouring and then require an emergency cesarean birth. It's important to note that elective cesarean sections may not be offered at every facility, or you may be birthing at a facility and with a care provider who are very happy for you to elect to birth this way. An elective cesarean section will happen in consultation with your care provider around about the 39th week of a healthy pregnancy. You and your doctor will book a specific date depending on the facility's operating days and your specific personal circumstances. In the few days leading up to your cesarean birth, you will be required to have some blood tests to check your blood type and your overall health and well-being. In most facilities, you will present to the maternity ward on the morning of your cesarean birth and proceed to have your baby sometime throughout that day. A medically indicated cesarean birth may occur for a number of factors. A medically indicated cesarean birth may occur because the risk of vaginal birth is too great. Reasons may include an abnormal placental placement, such as placenta previa. Maybe you have a breech baby or a transverse baby, or maybe you or your baby have a medical condition that presents a great risk for having a vaginal birth. Or you may labour and your baby becomes unwell and doesn't cope with that labour, or potentially your labour does not progress and then you end up requiring a cesarean birth. Ideally, your care provider would like you to have fasted at least 8 hours before the operation. Now this means no food, liquids including water. If you're labouring and then suddenly require an emergency cesarean birth, your care provider will weigh up the risks versus benefits if you have in fact eaten, so don't worry about that too much. The reason for fasting is because ideally we'd like your stomach to be empty so that if you become nauseated and vomit, it decreases the risks of you aspirating, which is basically the acidic stomach contents going into your lungs. And obviously, we really don't want that to occur. To decrease this risk, your care provider may give you a little medication, an alkalizing agent, to settle the contents of your stomach. Now, this little drink is called sodium citrate, and it's kind of like a bitter, lemon, salty drink. And just a little side note, shot that down really quickly because it's not the kind of drink you want to savor. Some things to consider just before your procedure are your medical team may consult with you about your previous medical history. They might pop a little monitor on your tummy to monitor baby's well-being, or they might use a little handheld Doppler. They will pop a little cannula in your hand or your arm because you will be required to have some IV fluids and medications throughout the birth. You may need to shave off some hairs from your lower abdomen so that they don't get in the way of the surgical field. Your care provider will discuss with you your anesthetic options. Now, these might be a spinal if you don't already have an epidural on board. A spinal anesthetic numbs you from just under the breasts down. This is quite a quick process and it usually happens within 10 to 20 minutes. Before any part of the procedure happens, your care provider will check with you numerous times to make sure that the anesthetic is working to really good effect. If for any reason throughout the procedure, doesn't matter if it's the beginning, middle, or towards the end, that you are feeling any discomfort, please remember to speak up nice and clearly and let us know because we can give you additional medication. After your spinal anesthetic is working, your care provider will then put a Foley catheter into your bladder. This is for a couple of reasons. The first is obviously the anesthetic is working really well and you don't realize that you need to use your bladder, empty your bladder. And the other reason is we want your bladder to be nice and empty so it's out of the way of the surgical field so it doesn't accidentally get nicked or cut while they're doing the procedure. When you're in the operating theatre, it's quite bright and quite cold. And there are a couple of reasons for this. The first is, obviously, we want it to be nice and bright so your obstetrician can see clearly what they're doing. The other reason is, I don't know if you've noticed it, but your obstetrician will be wearing quite a lot of layers. So they've got their gown on, they've got their gloves on, they've got their little scrub hat on, and it gets really, really hot under the lights. And obviously we don't want them to faint during the procedure, so hence why the theatre is quite cold. Just before your cesarean birth, we'll put some nice warm blankets on you and drape your stomach to create a sterile field, which is basically a nice clean area to reduce the risk of infection. The drape is usually blue in colour and it sticks to your tummy and folds out down over your legs and comes up near your face, and we usually clip it on 2 poles just beside your head so that you can't see the procedure. Now, some facilities actually have clear drapes nowadays, and if you are interested in seeing the entire process of the cesarean birth, talk to your care provider and your facility and just see if this is able to happen for you. It's important to note that whilst this process is happening, your support person will actually be waiting outside in the pre-op area. And the reason for this is because it is a sterile procedure, we want to decrease the risk of accidental contamination. Once the process has all happened, your partner will then be brought into theatre. Now, they'll be wearing some scrubs, some shoe covers and a little hat, and they'll be sitting beside you. Now, partners, it's really important to remember that this can be a really overwhelming time for our mums. So reassure her and make sure that both of you really embrace this moment because this is the birth of your baby. Theatres have a fair few people in them. So there's usually your doctor, an assistant, your midwife or nurse, you might have a paediatrician, you will have some theatre nurses and occasionally a few other people, including potentially a medical student or a midwifery student if your facility is a teaching hospital. And because there is quite a number of people in theatre, it is important to note that majority of the time you are only allowed 1 support person in your cesarean birth. When everyone and everything is ready and your anaesthetic is working to good effect and has been checked, your doctor will make a small incision about so big down below your underwear line. There are a fair few layers that they go through so that they can reach your baby, 7 to be exact. These include the skin layer, the fat layer. They then separate your abdominal muscles, go through another couple of layers, and eventually make a horizontal incision in your uterus to be able to reach your baby. Now, if your waters haven't already broken, they will make a small incision in the membranes and your waters will break, and then they'll be able to help your baby out. When they are trying to get your baby out, you might notice a lot of sort of pushing and pulling and tugging, and maybe an assistant will put a little bit of pressure on the top of your uterus from outside of your body and sort of help move your baby into a position where the obstetrician is able to get your baby out of the uterus. When this happens, they drop the drapes if you can't already see, and then you can see your baby being born and hear that first beautiful cry. Just a little side note, when that pushing and pulling occurs, it does feel a little uncomfortable, but it shouldn't be painful. And at any point, if you feel pain, immediately speak up, and so that your doctors and your care providers know. Once your baby's been born and you hear that beautiful first cry, they're going to cut the umbilical cord. Now, they usually leave this quite long so that your partner or your support person can then trim the cord when the baby is being checked by the pediatrician. Now, once the baby's been born and handed to the pediatrician, they usually take them over to like a little baby warmer or a bedside resuscitator, which is usually placed just beside mum's head so she can see what's going on. Provided your baby is happy and healthy and there are no concerns, your baby will be wrapped in a couple of layers of warm towels. And we do this because, remember, theatre is very, very cold and babies lose their heat quite quickly. So we wrap them up nice and warm. If baby's happy and healthy, baby comes over to mum and has a lovely little cuddle while they're finishing up the procedure. Now, some facilities will allow skin to skin in theatre and some only allow skin to skin in recovery. So when you are preparing for your cesarean birth, it's a really great idea to have the conversation with your care provider. Okay, what are your thoughts on skin to skin? And really advocate for skin to skin in theatre because there are so many benefits for both you and your baby. The rest of the time post your baby being born is when your obstetrician is then sewing up those 7 layers that they've cut through to get baby. And so this is a time where you just hang out, enjoy lots of cuddles, and hopefully be doing some skin to skin. When this process is finished, they will take you, your partner, and baby around to recovery. Now, the recovery area, you're there for about half an hour or so, provided you're happy and well. So we're going to just keep a little eye on your blood pressure and your heart rate, your temperature. We're going to monitor your cesarean wound, your incision. And we're also going to have a little monitor of the blood loss that you're having post-cesarean. Now, side note, for those who don't realize, having a cesarean birth means you still have postpartum bleeding from the vagina. As I said, you're in recovery for about 30 or so minutes, and provided all goes well and you're happy and healthy and your pain is managed, you'll then go back to either the maternity ward or the postnatal suites, and that's where you'll stay for the duration of your time in hospital. Wow, Frankie, so much to say about cesarean sections, but truthfully, I'll probably leave it there for today. If you have any more questions about cesarean birth, I'd love it if you just pop them in the comment section below and I'll answer you. Or for our mums who've had cesarean births before, share your experience with all our other lovely mummies. Okay,